So today we'll be talking about vitamin B12, also known as cobalamin. It's a water-soluble vitamin. It contains cobalt. That's why we have the cobalamin aspect of things in its name. The special note that we need to think about is that it's not synthesized by human beings. So it is a vital component that we actually take into our diet. Now, the vitamin B12 is actually synthesized by microorganisms. Now, there's a list of microorganisms here that produce vitamin B12. It's not exhaustive, but these are the highlights here. These are actually now the bugs that they use to actually manufacture the vitamin B12 that we actually get in our pill forms and our supplements and so forth. So Pseudomonas denitrificans, Bacillus megaterium, Propium bacterium, Fructorici, and E. coli. That's found in humans, though. The E. coli that we find inside our gut are found actually lower down in the gut itself, beyond the point at which it's actually absorbed in the body itself. So the animals themselves, they actually eat the food that has been infected by the bacteria themselves, and they obtain the vitamin B12 by eating these plants, and then therefore we eat those. Happy Braai Day to everyone. That's how we get our vitamin B12. It is not found in vegetables and in fruit. That's why with the vegetarians and so forth, that's why we actually give these individuals the supplementation. Now, how is vitamin B12 absorbed? Now, there's two vital components that we actually require to actually absorb vitamin B12. The first component is a low pH. So low pH then will indicate an acidic environment, which is perfect inside the stomach itself. Now, the low pH environment allows the vitamin B12 to be released effectively from the food itself. Now, this is quite important in the elderly population because in the elderly population, they seem to have a low acidic level within the tummy itself. So their vitamin B12 absorption will be much less as well. And we have to be cognizant of that so that we can actually investigate these individuals and be wary of vitamin B12 deficiency in these individuals. Low acid levels can also be found in those individuals where we ourselves intervene by actually putting these patients on our proton pump inhibitors, our H2 inhibitors, to decrease the amount of acid the body produces. So it helps them with their peptic ulcer disease, their gastritis, their reflux esophagitis, etc. So in those individuals that are on long-term Nexium, and I see a lot of those individuals incorrectly so, who are taking, Nexium, your Omezas, etc. And these individuals will have less tendency of absorbing the vitamin B12, and they might tend to be a bit anemic and so forth. So we need to supplement those individuals as well. The next one is intrinsic factor. Now, intrinsic factor is a glycoprotein that the body actually manufactures, and it is actually secreted by the lining of the stomach itself. Now, there are certain individuals that lack the intrinsic factor. Now, that's a genetic predisposition. They're born with a decreased ability to actually now secrete the intrinsic factor, and intrinsic factor is actually attached to the vitamin B12, and that allows us to actually absorb the vitamin B12. I'll come over to a schematic soon, and that will actually explain a lot more with regards to how vitamin B12 is actually absorbed within the body itself. Now, when we look at this diagram here, it might look rather sophisticated, but it's quite a simple kind of reasoning behind what's going on here. We'll start off first with our R protein, which is this protein here. This is actually secreted by the salivary glands that are located inside the mouth. So as soon as you ingest something, the R protein actually comes in, and then it's actually bound to the cobalamin or the vitamin B12, and it actually protects the cobalamin from the stomach acid itself, so that it doesn't eat away, so that we can actually absorb it. So once it actually now gets into the first part of the intestine itself, the duodenum, the bile acids and so forth actually come in there, assist with the absorption. And intrinsic factor the factor that we mentioned that is a genetic predisposition and people will have a deficiency of, the intrinsic factor now comes in here. There's a bile acid that actually cleaves or actually separates now the R over here, R protein, from the cobalamin itself. Remember, this is the blue section here is our vitamin B12, and it actually starts coming down and it attaches and hands it over to the intrinsic factor. Once it attaches to the intrinsic factor, it allows absorption of the vitamin B12 in the ileum of the small intestine. Now, approximately 50% of the cobalamin or vitamin B12 is stored inside of the liver, and the rest of it is actually taken to the rest of the body for all of the cellular processes that actually are vitamin B12 is actually required for. In fact, a good, handy, or rather amazing fact is that because the liver is so capable of storing vitamin B12, it'll take approximately a year or so for vitamin B12 levels to drop significantly before it becomes clinically evident. So that shows you now that the liver itself is an incredible organ, and we can actually, keep the vitamin B12 within our body for substantial periods of time. Now, the uses of vitamin B12, why should we care? Why is it so important? So the first thing is that it's important in your red blood cell formation. Now, red blood cells obviously are used to transport your oxygen and your nutrients throughout the body itself. And then a drop in your vitamin B12 levels will result in a macrocytic hyperchromic anemia. Now, simply put, that macrocytic hyperchromic anemia, these are the findings that we're going to see under a microscope. So on the left-hand side here, we're actually seeing the normal red blood cell. It's a relatively medium-sized kind of cell, and it has a lighter kind of a color to it. Now, if you compare it to the macrocytic hyperchromic anemia that we see in our vitamin B12 deficient individuals, you will see that the cell is a larger cell and it has a more pigmented type of appearance as opposed to the normal kind of a cell. Now, we need to test for that, and with our full blood count, we can actually have a look and see that these individuals now are vitamin B12 deficient by having a look at their MCV values and your microcytic, and obviously now your hypochromic, so the coloration of the cell, and that'll indicate now a vitamin B12. We also know that an iron deficiency would lead to a smaller kind of a cell and a lighter kind of a cell, our hypochromic and our microcytic anemias. The next role of the vitamin B12 is also for your DNA formation. It is responsible for the structural stability of the centromere, which is the central component here of the DNA itself. So we can see there's the nucleus there, and it has all our DNA strands that code for absolutely everything that your body does. So it's vitally important that we maintain our vitamin B12 levels. It's also responsible for our oligodendrocytes. So your oligodendrocytes are those cells that are responsible for your myelin sheath production. Now, the myelin sheath is essentially now covering over the nerve itself. Now, I can put it quite simply. If we look at a normal electricity cord, the plastic or rubber part that actually covers over the metal wire within it to protect us from the electricity, this is akin to the myelin sheath that is actually found surrounding the nerves themselves. And these assist with conduction of the nerve impulses. So if you have a vitamin B12 deficiency, your body can't put this layer over the nerve itself, and that there would result in poor conduction, leading to all of the symptoms that you actually experience of vitamin B12 deficiencies, your paresthesias, etc. The next one that it's responsible for is cell metabolism. Once again, a very complex slide, but it's just showing us that the cell metabolism itself is a very complex type of procedure to actually undergo for the body. And the vitamin B12 in this instance is actually a cofactor for two enzymes. Remember, enzymes speed up any kind of processes within the body itself. So this here attaches to the enzyme itself and speeds up the process that is actually involved in protein synthesis. Our body is composed of protein, so it is a vital component that we have vitamin B12 within the system itself in order for us to actually start to produce the proteins that our body actually requires. So it's vitally important that we actually maintain these particular levels. We're also, the vitamin B12 is also responsible. This here is a picture of a mitochondria. If we think back to our microbiology lessons, the mitochondria within the cell is responsible for the production of ATP, and ATP is the energy that our body actually runs on. So if we don't actually have enough ATP running around the system itself, we're going to start feeling fatigued. Our body's going to slow us down because the supply of energy and the demand that we're placing on the body itself, there's a massive mismatch between the two. So our body realizes that this is the case and it begins to slow us down. So we need to actually make sure that our vitamin B12 levels are quite good. Now, how much do we really need of the vitamin B12? So from birth to 6 months, we're going to need 0.4 micrograms. 7 to 12 months, we're going to need 0.5, slightly more. As the time progresses, we're going to need more. 1 to 3 years, 0.9. 4 to 8 years, 1.2. 9 to 13 years, 1.8. Once a person passes over the age of 13, we regard them as an adult, as we all know. So we're going to need 2.4 milligrams, both you and I, and those above the age of 13. Pregnancy is a high metabolic state. Remember, we're now supplying nutrients for not one individual, but two individuals. So we will need a lot more of the vitamin B12, amping that up to about 2.6. And then during breastfeeding, because you are obviously now manufacturing the milk that baby actually requires, we are transporting all of mother's nutrients onto baby as well. So we need to make sure that mom is getting at least 2.8 micrograms per day in order to maintain her values. What sources are there of vitamin B12? Now, there's multiple sources. And as you can see, a vegetarian's not going to do very, very well with regards to these here. We've seen nuts in here. These are nuts. But the amounts that you're actually going to get from that as compared to your meat products is vastly underwhelming. You can get it from your fish sources. You can get it from your milk sources. You can get it from your eggs, your cheeses, your poultry you've mentioned. And this here is a little picture of a clam. The resolution is not that great, but anyway, it does have a magnificent amount of vitamin B12 in it. So those that like your oysters and so forth, you're in a good space when it comes to your sources of vitamin B12. Now, what are the causes of vitamin B12 deficiencies? Now, the first one we'll discuss is your dietary factors. Now, especially in our country where we have many, many indigent patients who are coming from low socioeconomic backgrounds. These individuals don't have access to, high quality meat products. They're mainly processed food. You're going to lose your nutritional value there. Sometimes even eggs, they don't have that. Milk as well. So we need to ensure and even ask these individuals, about their diet and whether or not we can actually now, make any inroads, have an influence in their life and maybe try and get onto a feeding scheme or something along those lines. So at least they have the nutrition that they actually require, so we can give them the vitamin B12. Your vegetarians, we've already mentioned now that our main sources of vitamin B12 are meat-based type of food. So with vegetarians, there's very little apart from the nuts, as we mentioned, that actually allow vitamin B12 in significant amounts to actually now meet our daily requirements. Now, those individuals will require forms of supplementation, be it either orally or by injection. And nowadays we have the intranasal applications as well. The intrinsic factor deficiency, we've mentioned, and I'll recall that intrinsic factor is that substance released by the stomach itself, and that binds to the vitamin B12, allowing for absorption into the body in the small intestine. This is usually a congenital abnormality. So the patients are born with an intrinsic factor deficiency. And we need to ensure that we give these individuals the supplementation that they need and regularly monitor their particular levels. The next one is gastrectomy. So it's not really an intrinsic factor deficiency, but it will result in an intrinsic factor deficiency because of the fact that we've resected part of the stomach itself, be it for reasons like stomach cancer, sometimes even an ulceration. In those that have morbid obesity, you can have gastric resections, and those individuals lose weight. But the caveat to that, or the negative downfall of having these gastric bypass surgeries, is that we actually decrease the amount of nutrients that the individual can actually absorb. So, we need to take that into consideration when we are preparing these individuals or advising them along the lines of gastric surgery and so forth for weight loss. And remember, we're only going to keep that gastrectomy surgery for those individuals that are morbidly obese. And we all know about the dangers of having obesity, your increased risk for hypertension, diabetes, and your lifestyle, problems that we get. Gut infections can actually impair our vitamin B12 absorption in the body itself, as in bacterial overgrowth. So remember, our gut biome has millions, if not billions, of cells. And these are, so I would say, healthy bacteria that actually allow us to actually break down our food, etc. But in times of stress or an infection, then the gut biome will be, the pathological bacteria will actually start to rise quite significantly, resulting in bacterial overgrowth. And the resulting bacterial overgrowth makes sure that the gut biome doesn't actually absorb all the nutrients that actually require. Now, we'll need to treat these infections just to make sure that the individual does not have any deficiencies. You can do a stool sample, send it for microscopy, etc., and have a look and see now what bugs actually grow, and will be targeted in terms of our approach. You get fish tapeworms as well. So if we're eating our undercooked fish, hopefully all of us are getting our sushi from reputable places. But if you do have undercooked fish, the tapeworm now obviously survives, and that tapeworm now will attach to our gut, impeding the absorption of the vitamin B12 as well. Giardiasis is an infection with a parasite called Giardia duodenalis, and this is another infection that will now impair the absorption of the vitamin B12. It comes now to small intestine diseases. As we mentioned, the vitamin B12 is absorbed within the small gut itself, or the first part of the intestines. So Crohn's disease, which is an inflammatory bowel disease that leads to inflammation, which is of a chronic nature within the lining of the actual gut itself. And if you have inflammation and lots of fluid buildup, etc., the inflammatory fluids, the inflammatory cells, then the vitamin B12 together with the attached intrinsic factor will not then be able to be absorbed in the first part, the second part of the small intestine itself. Celiac disease. So these are individuals who will have a gluten sensitivity. We can actually test for that. You can use some anti-gliadin testing in terms of your blood, etc., to have a look and see if these individuals are indeed reacting to the gluten. You can have your challenge tests as well, where you can challenge the individual and have a look and see whether the symptoms actually present themselves on ingestion of the gluten-containing substances, as in your breads and etc. Then we have ileal resection. So the ileal resection now, as in with the gastrectomy, we are now resecting the intestines at a much lower place, which is obviously now within the ileum itself. This surgical resection, because of the Crohn's disease, we can sometimes, if the person doesn't settle down with medical management, we will have to go in after that and we'll have to resect that inflamed section of the gut itself. If the person has any kind of ileal cancers, intestinal cancers, etc., we'll have to resect that out and we'll have to anastomose or attach the intestines back together again. But once we've done that, obviously we've taken away the function of that particular area as well. Now we can give parental supplementation to these individuals to assist them with their vitamin B12 levels. And we need to be cognizant of that, so we can regularly test these individuals' food blood counts, vitamin B12 levels, etc., to make sure that we are keeping them in the best possible state of health. There are rare causes of vitamin B12 deficiency. Hypothyroidism, an underfunctioning thyroid gland, will have an influence on your vitamin B12 absorption. The drugs themselves, as we mentioned already, your PPIs or your H2 blockers, the drugs that decrease the amount of acid your body is actually producing, these will actually now decrease the absorption. So those that are on long-term Nexium and long-term PPIs, we need to regularly monitor these individuals for any kind of signs of vitamin B12 or cobalamin deficiencies. How do we supplement vitamin B12? Now, there's various different methods. So essentially, your vitamin B12 oral supplements, we have our B complexes, etc. And the bugs that we found that actually manufacture the vitamin B12, we've isolated these. They've grown them in massive petri dishes, and we've actually made them produce the vitamin B12 that we actually have. It's nice to stick to reputable brands and try to take it on a regular basis, but obviously keeping in mind what our vitamin B12 levels are. We don't want them too high. We want them in a nice Goldilocks zone, not too high, not too low. Next one there is your vitamin B12 injections. These are obviously our parenteral ways of getting it into the body itself. Now, we can differentiate between how much we actually need by seeing whether or not the person has clinical anemia, as in the pernicious anemias, your macrocytic hyperchromic anemias. For those particular individuals, we're going to administer to them 100 micrograms daily for about a week or so daily. And then as a maintenance dosage, we can jump that up to 1,000 micrograms on a weekly basis. And then obviously, if they only have a deficiency going on, you're going to drop that amount down to 30 micrograms per day over the course of the week. If all has gone well there, then you can start doing a monthly injectable of 100 to about 200 micrograms monthly. Remember, with any kind of supplementation, if you overdo it, it's very rare to get toxicity unless you're going with incredible amounts. Your body is an incredible structure. If you maintain your hydration and so forth, then your body will just be creating expensive urine. If any of you do take supplementation, what you might notice is that a few hours after taking the supplement, your urine itself might be a very dark orangey, yellowy kind of a color. That's not a sign of you being dehydrated. That's essentially all of your multivites that your body didn't actually require, or just leaving the body itself. So as I mentioned, just a lot of expensive urine. The latest version is essentially an intranasal I myself have not had any experience with the intranasal administration. There are a few products available, and with those ones, you can use it on a weekly basis. And even if you have pernicious anemia, or if there is only a vitamin B12 deficiency going on, you can still use the same dosage for both of those individuals. Now, how do we inject these individuals? So basically, this is a little diagram here of the different sites that one can use to actually administer your injections. So we've got the deltoid muscle here, we've got the anterior thigh here, and we've got the buttock over here. All right, we don't usually give it on the lateral aspect of the thigh, so we're going to leave that out for now. But when we're injecting, we must be cognizant of the fact that we have neurovascular bundles. So essentially, to simplify it, these are little cords that run anteriorly here, and we have one that actually lies straight down here. And these neurovascular bundles now are what actually now supplies the nerve conduction and the vasculature, or the blood supply, to the arm, and down here to the leg, and here to the anterior part of the leg itself. So if we bear these markers in mind, then at that stage, let me just draw that in there, and in there, and in there. So if you bear these markers in mind, then obviously you will know that we can't inject ourselves here, we can't inject ourselves here or here. If we do these here, we can actually now damage the neurovascular bundle. We can actually bleed out the patient itself after we hit an artery, or we can actually lead to paralysis in that particular individual because of the fact that we've injected them in the wrong area. So remember, even though we have a tiny needle that we're actually administering our parenteral vitamin B12 injections, we must make sure that we don't sever these nerves and we don't injure the neurovascular bundle. So if we are going to give it into the deltoid area, if we're going to choose the middle deltoid, you can actually just pinch the skin a little bit, try not to grab the muscle, try and actually pinch it such that you're only pinching the skin and the subcutaneous tissue, so that when you're actually injecting, all you're getting down to is essentially now the muscle layer itself. The same thing now here, we're going to actually administer it just on the top right-hand side. I think I actually have a slide of that soon. So we're going to apply it or inject the individual on the top right of the area itself, just over, apologies, let me just go back here. There we go. All right, so we're going to inject the individual on the upper right-hand side, in this particular case here, or the upper left-hand side quadrant here, or in the middle deltoid here. And in the anterior part, we're trying to avoid, obviously, now the neurovascular bundle here. So we are going to inject the individual around here, but I wouldn't really recommend this area here. Let's try and stick with basically the deltoid and the gluteus muscles themselves, because these are the areas that we're all very, very familiar with. I don't think that we're actually going to run into any trouble if we only stick to these two areas here. The intramuscular injections, as I mentioned, it's intramuscular, it's not subcutaneous. So essentially now we don't want the needle itself to actually now end up under the skin itself in the subcutaneous tissue. We actually want to make sure that we drive the needle down all the way into the muscular tissue itself. Now, a handy rule of thumb is that depending on obviously now the morphology or whether the patient is a bit weighty or not, but you're going to introduce your needle such that 2/3 of the needle itself is actually now into the patient's body, so that we actually now don't inject it into the subcutaneous fatty layer or under the skin itself. Coming back to that intranasal B12, now this is a little picture of an intranasal that is in South Africa. And this year you're going to be using it weekly, and the dosage for that there is 500 micrograms on a weekly basis. As I mentioned, be it either for your pernicious anemia, or if there's only a vitamin B12 deficiency going on there. Now, there are certain signs of vitamin B12 deficiency. and we need to be cognizant of these. If we encounter any individual that we see that is coming in complaining of fatigue, poor balance, memory loss, paresthesia, shortness of breath, and a reduced sensation to touch, anemia, we can have clinical signs of the anemia, obviously. So you're going to see now your pale mucosa, you're going to see your changes in your palm even, the patient will come in rather pale, but that day we're waiting for really severe anemias before we actually pick up those particular deficiencies in those particular individuals. So I usually recommend to all of my patients to at least get, and I hope that all of our colleagues are actually doing it as well, try to get your bloods done at least once a year. So your full blood count, that will reveal now whether or not you have your vitamin B12 deficiency. It's a relatively inexpensive way of actually revealing it. I wouldn't jump to the additional cost of the vitamin B12 just yet. Just have a look and see what the full blood count looks like. And if the full blood count is fine, then we're in a good space. If we do find that we are revealing a slight bit of anemia together with a macrocytic hyperchromic picture, then at that stage, then we can maybe consider doing vitamin B12 levels in those particular individuals. Fatigue, obviously, there's many reasons for it. I find by far and large, the fatigue is actually caused by more dehydration than vitamin B12 deficiencies, except for obviously your vegetarian individuals that aren't supplementing themselves. But if they do complain of fatigue, let's jump up to, investigate them once we've ascertained that they're exercising regularly, they're hydrating well, they're eating regularly. In fact, their lifestyle is in a good space. Your poor balance, your memory loss, and your paresthesias, these will come down to the neurological effects of the vitamin B12 deficiency. If you can recall our slides just before this here, let me try and actually jump to that if I can. There we go. The myelin sheath or the oligodendrocytes require vitamin B12 in order to actually manufacture the myelin sheath itself. So if you have a vitamin B12 deficiency, you're going to have less of this myelin sheath. In order for the nerve signal to actually travel down to where they actually need to be functioning, it requires this myelin sheath to actually now insulate the wire itself. So when we have now the wire traveling inside, we have demyelination because of the lack of the vitamin B12. The impulses that actually travel through the particular system itself will not be in a good space. So those individuals now will have altered sensations, as I mentioned, your paresthesias. And these individuals now will also have your memory losses, your poor balance. Your poor balance is obviously because you remember you have your proprioceptors. Your proprioceptors are those little organelles around the body itself that even when your eyes are closed, you will know that your hand is where it is, your brain is where it is, your limbs are exactly where they are. So it's a very unconscious thing that occurs, but we take our body for granted. When we have our vitamin B12 deficiencies, the lack of the myelin sheath formation, then the nerve conduction will not be good at all. And those individuals will have your altered sensations, and your poor balance will therefore result from that particular lack of vitamin B12. And then obviously your reduced sensation to touch, also neurological, and your shortness of breath. Now, that comes down to your red blood cells and perhaps your anemia as well. So your body will have to work a lot harder because you have low quality blood that is actually traveling throughout the system itself. If you need an 18-wheeler to transport all your oxygen and nutrients around, and you're only left with a 4-wheeler, you obviously now are going to be slowed down, and that's going to lead to your shortness of breath because your body can't transport the oxygen around the system itself. So it's going to try and slow you down in whichever manner it actually now feels it can actually do that. Now, if we see any of these signs and symptoms actually occur, remember these things will overlap with multiple different types of pathologies. But if any of these signs of vitamin B12 deficiency appear to you in a clinical setting, then that should actually pique our clinical curiosity and advise these patients to 100% investigate the matter further. So then we will reveal whether or not they have any deficiencies, and then we can obviously assist them in whichever manner that we actually deem necessary, parenteral, intranasal, or even oral supplementation. So that brings us to the end of our discussion, and I will open the floor to any questions.
Yeah, thank you very much, Dr. Nathaniel. That was quite interesting. And, expect a supplement to have such an effect. Yeah, no, great stuff. So again, guys, if there's any questions, you can tap on your screen once. There should be a raise hand option, or just chat. If you need to or have any questions, feel free to ask. So we just give it a few seconds there. And then just a quick thing. So give it a few seconds, and then we'll do also the top 5 performers of last month in just a second. And just a quick recap. So also regarding these neurobion injections and the scripts that goes with it. So currently you will still need to do a normal consultation via the platform as per usual. So you can request a repeat script via that. So we do not have our scripting tool just ready for that. I believe it's a 99 offering that you have. So that's not operational as of yet, but you can do it via normal consultation with a doctor. I see there's one question here. I don't know if you can see that, Doctor.
No, if you can read it out.
It's under the Q&A section, but it's what causes very high levels of vitamin B12 if there's totally no supplementation?
So in those particular individuals, then we need to actually now research their lifestyle and their diet. Now, remember, you can also get a concentration effect. So if the person is dehydrated, then you're going to get these abnormally high kind of levels. You'll see it on their UNEs and so forth. These people are dehydrated, and it becomes just a concentration effect at that stage. The next thing that we'll actually investigate is the patient's diet. So you have a look and you see now whether or not these individuals actually have a diet that might lean towards an excessive amount of vitamin B12 within the system itself. But those are the main kind of, reasons as to why that would occur. But, to be honest, most of the time I find that it is a supplementation problem. And this is the issue that I find, with vitamin B12 and energy. When people see that red or yellow liquid that's glowing in the syringe, just before you inject them, they have this perception that as soon as I get this injection, I'm going to be injected with gummy berry juice, where I'm going to be bouncing around all over the place. And most of the time, it turns out that it's actually a placebo effect that is actually going on, where the patient itself, if we did their bloods, they're not actually vitamin B12 deficient. They're not even anemic. They actually have this placebo effect. If I inject myself with this thing, I'm going to feel a lot better. So it's actually now, doctor and nurse caused, where we actually now over supplement these particular individuals because they're asking for it. But I try to caution these individuals that, remember, now too high and too low, you're going to have problems with either. So it's best to actually now, make sure of what you're actually dealing with. Then you can actually now supplement those particular individuals. Good.
All right. Any other questions? It seems like the clinics are starting to open up as well.
Sure.
So again, thank you very much, Dr. Nathaniel. That was very informative. I'm sure this.
No Down before I close off, could I just ask one favor from all of the nurses that are still with us?
Yeah.
Sure.
Please do.
So if when we're actually consulting together, I think it'll help both of us, quite tremendously. It'll help both of us with a lot of time. If we had just a brief summary of what the patient is in for, when we are consulting, and if we can possibly get the vitals out of the way right at the beginning, so that as soon as we kind of discuss the patient together, we already have all of the tools that we need. We have the vitals, we have the patient's temperature, blood pressure readings, etc. And we have a brief outline. Now, we don't have to write now paragraphs and write an entire Bible, but what I'm asking for is 2-3 lines max. Patient came in with cough, runny nose. Patient came in with hypertension. Patient came with a headache. And these are the vitals, all right? Then we can get the ball rolling as soon as we begin. So, please, guys, I would really, really, really super appreciate it. I'm sure our colleagues will also appreciate it if you could actually now do us a favor and get that out of the way. Thank you, guys.
Yeah, 100%.